Hi, my name is Gabrielle Entile with Drug Topics, and today we're going to be talking to Dr. English from the Rutgers School of Public Health. But first, here's the latest news from drugtopics.com. New data of remdesivir for the novel coronavirus through its compassionate use program show clinical improvement in the majority of patients treated with the experimental therapy, according to an analysis published in the New England Journal of Medicine. However, data are still limited and will require future controlled clinical trials to better determine remdesivir's use as a treatment for COVID-19. New research has identified an association between sensory loss and COVID-19 infection, indicating that loss of smell and taste may be considered early symptoms of the virus, according to the International Forum of Allergy and Rhinology. And that's the latest from drugtopics.com. Hi, my name is Gabrielle Entile with Drug Topics, and today we're talking to Dr. Devin English, Assistant Professor at Rutgers School of Public Health. Dr. English, whose research is focused on how forms of oppression lead to health inequalities in the United States. And today we're talking about how COVID-19 pandemic is affecting minorities. Dr. English, thanks so much for joining us today.
Thank you so much for having me, and thank you for focusing on this important topic.
And are different minority populations being affected at similar rates? For example, are there currently demographic data, not only by race or ethnicity, but also including minorities like LGBTQIA populations that show the various populations being affected?
So that's a really important question because it gets at some of the intersections that we are not considering in this pandemic. We know that older communities, that low-income communities, and that men are dying from COVID-19 at the highest rates right now. However, as you ask, I'm not aware of any robust federal or state efforts to identify rates of diagnosis and death among LGBTQIA communities. This is incredibly problematic because LGBTQIA communities, and particularly LGBTQIA communities of color, have elevated rates of pre-existing conditions that put them at risk for COVID-19 related death. So that includes things like asthma, HIV, and diabetes. LGBTQIA communities are also more likely to be homeless and have less access to quality healthcare. So the fact that there are not robust efforts to collect data regarding sexual and gender identity is extremely harmful to LGBTQIA communities for the reasons that I mentioned. Because if we're not collecting this data, then we can say that it's not real, right? There can be a denial that COVID-19 is affecting LGBTQIA communities.
And how do you see the various roles within the healthcare system addressing this issue? Do public health officials and the president's administration, hospitals, doctors, nurses, and pharmacists, what roles should they play in addressing this?
Yeah, it's a good question. And I think that, for our frontline healthcare workers, they're the ones who are going in every day. They're risking their lives. They're doing absolutely all they can to address COVID-19. But because the inequities that we see in COVID-19 that are emerging in the data, because we know that those are linked to government policies that have systematically directed resources and opportunity away from Black and Latinx communities, away from LGBTQIA communities, because of this, the government should be responsible for addressing COVID-19 and these COVID-19 inequities that we see. And so a couple ways that I think that this can be done. First, no person should be responsible for deciding between the health of their family and feeding their family. Government funding should ensure that financial assistance is accessible, including to our immigrant communities who are so often left out of government relief programs and bailouts. There should also be a surge of testing and clinical care in Black and Latinx communities. These are the people who need it the most. These are the communities that are being hit the hardest by COVID-19. We should match our treatment and our care to where the need is the most. And in the longer term, the economic and public health impact of COVID-19 will go far beyond the next few months. And the impact will include not just health, but the economic resources of state and local governments, and including the federal government. And so down the line in the next couple months, when governments are making the decision on where to balance their budgets, it is incredibly important that we are not balancing budgets by cutting the programs that are supporting Black and Latinx communities, are supporting LGBTQIA communities, particularly those in densely populated and low resource neighborhoods. And I really believe that if we can invest government resources into bailing out corporations, then we should be able to invest in Black and brown communities. We should be able to invest in LGBTQIA families and communities. And because these are the families and communities that we have failed over generations, that the government has failed over generations.
Dr. English, thank you so much for shedding light on this super important topic today. And stay safe out there. Have fun quarantining.
Yeah, absolutely. Yeah, thank you so much for having me.